Okay, Sawasdee krap. Dear ladies and gentlemen, so I am Kanathip Jongmekwamsuk from the Faculty of Medicine, Chulalongkorn University. Today I'm going to present about the exploring contact lens usage and prevalence of the hordeolum. So since we know that the global use of the contact lens has been increasing in the recent year due to numerous advantages compared to the glasses. So with their application extending beyond just vision correction, contact lens has been increasingly used for the medical purpose, cosmetic purpose, and etc., particularly among the younger generation. So period study of the contact lens usage among university student age group has found that this age group have the most improper contact lens hygiene compared to other age group. However, there are limited data about the association between contact lens usage and hordeolum among this age group. So we determined to explore contact lens usage and the prevalence of the hordeolum among Thai university students. So we performed a cross-sectional study via online survey. Our target population are university students aged more than 18 years old, studying at either Chulalongkorn University or Thammasat University in 2023. So the questionnaire comprised demographic, health determinants data, contact lens usage, behaviors, and the hordeolum related topic, including history and management. So among 276 participants, 35.9% were contact lens user and 89.8% of them used contact lens for vision correction, and 56.4% of them use for contact lens for cosmetic purpose. So we can say that the most purpose of the contact lens usage is still vision correction, but there are still more than half of them used for the cosmetic also. So the result are fine. The first part we talk about the contact lens usage behavior. So median daily usage duration was 10 hours per day, with the majority of the participants use contact lens between 6.5 to 13.5 hours. So with the recommended duration of contact lens usage daily of 12 hours, so we can find contact lens overuse in 14.1% of participants. Then we identify the contact lens hygiene on the bar graph on the left side here. We can see that they're both good and poor contact lens hygiene. With the green one is a good hygiene and the red one is a poor hygiene. So the good hygiene were hand washing before inserting and before removing contact lens, and poor hygiene were sleeping with lens, swimming with lens, and contact lens overuse. So on the horizontal bar graph below here, we calculate the odds ratio for each behavior, and we can find that there although there are 40 to 60% of contact lens use stage with sleep and swim with contact lens, the odds ratio suggests that it is contributive factor, but not significant to be found in this study. The second part, we explore about the prevalence of the hordeolum among both contact lens and non-contact lens users. So the trend of developing hordeolum among contact lens users is more than non-contact lens users. However, there is no significant association between contact lens user and the history of hordeolum. So this tends to support that hordeolum is one of the common intercurrent diseases due to the risk of bacterial contamination of skin and soft tissue among contact lens users. And the last part is the management of hordeolum. So we identify how they manage their hordeolum with the multiple options simultaneously can be performed. So common management were spontaneous resolution, doctor visit, and over-the-counter antibiotic with a similar percentage around 40%. Surprisingly, only 26.9% of them did warm compassion, which is the first line treatment of hordeolum. So the case of the doctor visit and antibiotic should be preserved for chronic or extended hordeolum. So the key management is hygiene around the eye, including a good contact lens hygiene. So as a conclusion, the purpose of the using contact lens is still merely for vision correction with increasing cosmetic purpose, but there's still need of patient education and caution about sleeping and swimming with contact lens. Thank you for your attention.
Thank you. Did you look at the duration of contact lens use in association with having the hordeolum? Like how long the user has been using the contact lens or since they started?
So yes, we do collect the data about how long whether contact lens usage associated with the hordeolum, but we mainly, so you means like a daily usage or like how long have they have been used the contact lens in
Lifetime,
terms of
like
money?
lifetime.
Oh, lifetime?
Yeah.
Yes. So in the presentation here, we can see that um, yeah, we do have that data in our survey, but we didn't show it here. So it is like the next step that we are going to look also, because the duration of their lifetime usage, I think it will associate it with the audio also. But thank you for your suggestion.
Hello, congratulations. Very interesting topics on the usage among adolescents, and very surprised data on the purpose of the use of the contact lenses used for cosmetics. Do you have any information on the source of the contact lens? Whether is over counter, illegal, without authorization, or is this doctor prescription? Do you have information on the source of contact lens?
Yes, from our survey, we can see that only 5.1% of the contact lens user got the contact lens from the medical facility, including pharmacy and from the doctor prescription. About half of them got it from eyewear shops. So I think it's the most common way people can get a contact lens. But there are also like online and clothing market that they can get the contact lens up to 40%, which is quite surprised that they got it quite very convenient. So which can lead to like a poor hygiene instruction from the sellers.